Hi, I'm Janelle Cross with Align Retirement Plan Advisors. We are here to help you make the most of your company's retirement savings plan. In this video series called Ready, Set, Retire, we help you prepare for your transition to retirement, and in this session, we'll talk about healthcare in retirement. What do you think of when you think of retirement? What will a typical day as a retiree look like? We spend a lot of time planning for things like vacations, parties, even new car purchases. We might think about retirement, especially during tough days at work, but are we really planning for it? If you're like most folks, you probably don't have much experience when it comes to retirement, and that's why we put this workshop together. In this Ready, Set, Retire series, we will tackle questions related to generating income and understanding the Social Security system. We also discuss the importance of staying connected. At the center of retirement planning, however, is a clear understanding of your expenses and your income needed. One of the reasons this is a difficult task is because some of your largest expenses might be unknown. In this session, we focus on preparing for healthcare costs in retirement, including Medicare, long-term care planning, and uses for your health savings accounts, also known as HSAs. Making a reasonably accurate estimate for healthcare costs might be the difference between thriving and just getting by in retirement. From the Medicare alphabet soup to advice on long-term care, it's easy to feel confused about retiree healthcare. We're going to start our discussion with Medicare, our national retiree health insurance plan. Every person age 65 or older is required to apply for Medicare. There are exceptions for folks who are still employed after age 65. More on that in a minute. The initial enrollment window for Medicare is an important one. You can enroll during a window that opens 3 months before your 65th birthday and closes 3 months after. There are penalties for missing this window, so this is an important deadline to keep a very close eye on. Because this is such an important thing to remember, I added an extra slide. So to repeat this important piece of information, you have a 7-month window that opens 3 months before you turn 65 and closes 3 months after you turn 65. If you are still working at age 65 and are covered by your employer's plan, you'll want to talk to your benefits department. Find out whether your workplace health insurance plan is considered creditable coverage, which means you may not have to apply for Medicare until you retire. In this case, you'll have a special enrollment window that opens when you separate from service and closes 8 months later. Note, the window is much shorter, 63 days, for certain components of the Medicare program. Okay, now let's tackle the alphabet soup of Medicare. There are different parts of the Medicare program. Each covers different medical expenses. Let's look at each one by one. Part A is commonly known as the hospital insurance. There is usually no cost for this coverage if you or your spouse paid Medicare taxes during your working years. Part A covers inpatient hospitalization and short-term skilled nursing if needed after a hospital stay. An important note here, when it comes to long-term care and skilled nursing, Medicare coverage is dependent on the situation that came before the need for skilled care. Generally, you must be admitted to a hospital as an inpatient and receive care for 3 or more days before being discharged to a skilled nursing facility. If you were in the hospital as an outpatient and were then discharged to a skilled nursing facility, it's likely that Medicare Part A would not cover those costs. Part B is commonly called medical insurance. Part B covers doctor's visits, preventative care, medical equipment, and outpatient services. There is a monthly premium for this coverage as well as deductibles and copays. The premium is means tested, which means the cost of coverage is higher for those with higher income. As long as they accept Medicare, you can see any doctor or provider you wish with your Part B coverage. Depending on your situation, cost of coverage, or the level of coverage needed, Original Medicare Parts A and B may not be your best option. Instead, you might consider a Part C Medicare Advantage plan. This type of coverage is offered by private insurance companies approved by Medicare. It combines coverages associated with Parts A and B into a single plan. Many plans also cover Part D, prescription coverage, which we'll talk about next. Finally, you may elect to include dental, vision, and hearing coverage in a Medicare Advantage plan. There is a monthly premium as well as copays and deductibles. One thing to note, these plans can be less expensive or offer better coverage, but the trade-off is that you might be subject to a designated provider network. If you have a strong relationship with your doctor or prefer a specific hospital, make sure they participate under the plan you're considering. To compare Medicare Advantage plans to original Medicare coverage, we recommend you schedule an appointment with a Medicare insurance professional. Medicare Part D is the prescription benefit coverage that was added to Medicare in 2006. You pay a monthly premium to a private insurance carrier approved by Medicare. You will need to use the insurance carrier's network of pharmacies to purchase your medications. Instead of paying full price, you will pay a copay or a percentage of the drug's costs, and the insurance company will pay the rest. Most of these plans are subject to a coverage gap commonly known as the donut hole. The donut hole is a coverage gap that is triggered when prescription costs reach a certain limit. When you're in the donut hole, you'll be required to pay more for your medicine. If your prescription costs exceed the limit of the donut hole, catastrophic coverage begins, and your costs will likely go down again. In 2020, the donut hole started when the total cost of medication exceeded $4,020. Catastrophic coverage begins when expenditures exceed $6,350. Note that drugs covered by one carrier may differ from those covered by another carrier, so here again, consulting a Medicare insurance professional when purchasing Part D coverage is recommended. Medigap is a supplemental insurance policy that helps pay for the things that Medicare doesn't. It can cover copays, coinsurance, and deductibles. These plans are offered by private insurance companies. Coverage and premiums vary, so it's a good idea to chat with a professional if you're considering this type of coverage. One brief note about two programs that are often confused, Medicare and Medicaid. Medicare is our national retiree health care program, whereas Medicaid provides benefits for low-income Americans. You may hear about folks giving away assets so they qualify for Medicaid. A common reason for this is to pay for long-term care. This is a difficult strategy to execute due to the 5-year look-back period. This means that any assets you give away within 5 years of applying for Medicaid are deemed as still owned by you and may disqualify you from receiving benefits. Due to the complexities of this situation, we recommend you consult with a legal professional on this topic. As you can see, there's a lot to consider when it comes to Medicare. Before we move on, let's review the window to apply for benefits. The initial enrollment window opens 3 months before your birth month and closes 3 months after. If you're still working at age 65, be sure to check with your benefits administrator to see if you can delay your application to Medicare until you retire. In this case, you'll have a special enrollment window that opens when you separate from service and closes 8 months later. Again, don't miss this opportunity or you'll be subject to possible penalties. As your situation changes, you may need to change your coverage. You can do that each year during the open enrollment period, which runs from mid-October to early December. I like to tackle Medicare first because it has so many moving parts, and for many retirees, it will cover most of their healthcare expenses. Understanding the premiums associated with your desired level of health coverage is a critical part of accurately estimating your retirement income need. But insurance premiums are only part of the equation. Thanks to inflation of healthcare costs, which has been driving up costs by about 5% annually over the past decade, and longevity, we can't simply acquire Medicare insurance and assume that we've done all the planning necessary. In fact, longevity can create even more problems for retirees because the longer we live, the more likely it is that we might find ourselves needing long-term care. One very important expense not covered by Medicare are the costs associated with long-term and skilled care. Approximately 7 in 10 individuals over the age of 65 will incur some type of long-term care expense. But you might be thinking you're healthy, so the odds are you won't need long-term care. Although it sounds counterintuitive, healthier people may be even more likely to require long-term care than unhealthy folks. Similarly, women are more likely to need it than men. And long-term care comes with a steep price tag. According to the 2019 Genworth Cost of Care Survey, the national median cost of a nursing home stay with a private room was over $102,000 per year. So what are your options for planning for this expense? You can purchase long-term care insurance. These are policies from private insurance companies that vary in the length of time benefits are paid, the amount of benefits paid, and the cost of coverage. Like most insurances, the coverage is more affordable for younger persons, so the sooner you apply, the lower your premium. If you need long-term care, having an insurance policy might give you more facilities to choose from. When patients have insurance, providers feel more comfortable that they're likely to be paid for services rendered. Some people don't like the idea of long-term care insurance, though, because premiums can change and you may not ever use the coverage. As an alternative, there are policies called linked benefit insurance plans. This product combines life insurance with long-term care coverage. Instead of paying premiums, you make a lump sum purchase, which provides a designated level of each type of insurance. If you don't need the long-term care coverage, your beneficiaries receive a tax-free life insurance benefit. Finally, you can self-insure. This might mean designating specific assets not to be spent except for long-term care, or it can simply mean winging it and hoping you either don't need long-term care or that you can afford it when that time comes. In evaluating the needs of your household, we recommend you consider how retirement assets are divided between spouses. For example, consider John and Joan. They both have Social Security, but John's benefit is higher. Joan has a pension and an IRA that is worth $300,000. John has a smaller IRA worth $150,000 and does not have a pension. If Joan needs long-term care, the provider can require that Joan's Social Security, pension, and $300,000 IRA be spent to pay for her care before she qualifies for any type of assistance. With an extended illness, this could leave John without the income he needs. You may want to consider this as you evaluate the need for long-term care insurance or perhaps additional life insurance if one household member has greater assets or income than the other. Okay, we've almost made it to the end of this complicated subject, only 2 topics to go. First, health savings accounts. Through your employer, you may have the opportunity to fund an HSA account. Since you don't have to spend your HSA before you retire, we encourage you to save as much as you can in your account. Try to avoid spending it too, because you can use those dollars to pay for medical expenses, even insurance premiums, in retirement. And HSAs are one of the few places where Uncle Sam allows for a triple tax benefit. You take a tax deduction for your contributions, your savings grow tax deferred, and you take the money out tax-free. It's basically a supercharged IRA. Finally, one conversation that's never fun is the one about leaving your home. While this doesn't immediately seem like a conversation related to healthcare planning, in many ways it is. Consider your answers to these 3 questions. As you get older, who will you meet for ice cream? Who will take you to your appointments? And who will change a light bulb for you? No one looks forward to this decision, but talking about this before your situation becomes urgent is a good idea. Retirement communities help you maintain connection through gatherings like ice cream socials. They offer services that help you get back and forth to important appointments, and they take away much of the burden of maintaining your physical living environment. These things might give you more peace of mind, allowing you to embrace your retirement years more joyfully. Preparing for retirement can be like a real-life Jekyll and Hyde movie. One minute you're excited about planning a cross-country road trip, and the next minute you're figuring out who will get your stuff when you die. It is no doubt both thrilling and nerve-wracking, but planning ahead and getting help from experts can take the edge off. You'll have more confidence and a better sense of security as you prepare for this major life transition. You've been used to getting up every day with a list of things to do and people to see. You've been used to having people depend on you for decades. Changing those constants will create a void. Give yourself the gift of planning ahead so that void is an opportunity and not a curse. Think about hobbies, your community, your friends, opportunities to volunteer and give back. These things can be integral parts of keeping you healthy and happy in retirement. It is both our honor and our privilege to help folks like you prepare for this very important transition. If there is any advice or support that we can offer, please connect with us. Thanks for watching.